81. A nurse is caring for a postoperative patient who is complaining of severe pain. Which of the following interventions would be most appropriate to help manage the pain? A. Administer opioid analgesics as ordered and evaluate pain relief. B. Provide warm compresses to the surgical site. C. Position the patient in a position of comfort and encourage relaxation. D. All of the above. Answer: D. All of the above. Rationale: a combination of interventions is often the best approach to managing postoperative pain. Administering prescribed opioids, A. Applying warm compresses, B. And positioning the patient comfortably while encouraging relaxation, C. Will all contribute to pain relief. 82. A nurse is caring for a patient with acute pain related to a recent injury. The patient requests pain relief, but there are concerns about opioid misuse. Which of the following actions should the nurse take? A. Administer the pain medication as prescribed and monitor the patient's response. B. Encourage the patient to use alternative pain management strategies instead of medications. C. Withhold pain medications until the healthcare provider is consulted. D. Administer a non-opioid analgesic and monitor the patient for effectiveness. Answer: A. Administer the pain medication as prescribed and monitor the patient's response. Rationale: the nurse should follow the prescribed pain management plan and monitor the patient for any signs of misuse. Alternative strategies, B, can be explored, but they should not replace the prescribed medications. Withholding medication, C, or offering non-opioid analgesics, D, without guidance from the provider may not address the patient's acute pain effectively. 83. A nurse is caring for a patient who has been given an opioid for severe acute pain. The patient becomes drowsy and has a slow respiratory rate. What is the nurse's first action? A. Administer naloxone as ordered. B. Increase the oxygen flow rate. C. Call the healthcare provider. D. Assess the patient's blood pressure. Answer: A. Administer naloxone as ordered. Rationale: naloxone is the antidote for opioid overdose and should be administered first to reverse the effects of respiratory depression and sedation. Increasing oxygen, B. Calling the provider, C. And checking blood pressure, D. may be necessary but are secondary to naloxone administration. 84. A patient is using heat therapy for pain relief. Which of the following is a potential risk associated with the use of heat therapy? A. Skin burns or tissue damage. B. Increased blood pressure. C. Nausea or vomiting. D. Muscle weakness. Answer: A. Skin burns or tissue damage. Rationale: heat therapy can cause skin burns or tissue damage if applied for too long or at excessive temperatures. Blood pressure, B, nausea, C, and muscle weakness, D, are not typically associated with heat therapy. 85. A nurse is caring for a patient who has been prescribed non-steroidal anti-inflammatory drugs, NSAIDs, for acute pain. What is the most important side effect for the nurse to monitor in this patient? A. Gastrointestinal bleeding. B. Tachycardia. C. Sedation. D. Urinary retention. Answer: A. Gastrointestinal bleeding. Rationale: NSAIDs can cause gastrointestinal bleeding, which is the most important side effect to monitor. Tachycardia, B, sedation, C, and urinary retention, D, are not common side effects of NSAIDs. 86. A nurse is caring for a patient who has been prescribed a PCA, patient-controlled analgesia, pump. The patient asks the nurse, "How will I know if I have had enough pain medication?" The nurse should respond with which of the following? A. You can only use the PCA pump once every 4 hours, so you won't overdose. B. You should feel relief from your pain, but if you feel drowsy or have trouble breathing, let me know. C. The PCA pump has a built-in safety feature that prevents overdosing. D. You should stop using the PCA pump when your pain is completely gone. Answer: B. You should feel relief from your pain, but if you feel drowsy or have trouble breathing, let me know. Rationale: the nurse should educate the patient about using the PCA pump safely, including monitoring for symptoms of overdose such as drowsiness or difficulty breathing. While PCA pumps have safety features, C, the patient should be aware of their symptoms and alert the nurse if they experience any adverse effects. 87. A nurse is assessing a patient for acute pain. Which of the following is the best indicator that the pain is severe? A. The patient reports pain as a 4/10 on the pain scale. B. The patient is crying and grimacing during movement. C. The patient is unable to sleep at all due to pain. D. The patient is able to maintain normal blood pressure despite the pain. Answer. B. The patient is crying and grimacing during movement. Rationale. Nonverbal cues such as crying and grimacing indicate that the pain is severe. While the pain scale, A, can provide an estimate, the physical response, B, is a more immediate indicator of the severity of the pain. Inability to sleep, C, and normal blood pressure, D, may not always correlate with pain severity. 88. A nurse is caring for a patient who is receiving opioids for severe acute pain. Which of the following interventions is most important to prevent complications of opioid use? A. Encourage the patient to drink fluids regularly. B. Monitor for signs of respiratory depression. C. Administer a stool softener as prescribed. D. Educate the patient about the possibility of drug dependence. Answer. B. Monitor for signs of respiratory depression. Rationale. Respiratory depression is a serious and life-threatening side effect of opioid use and should be closely monitored. Encouraging fluids, A, administering stool softeners, C, and providing education, D, are important but secondary to monitoring for respiratory depression. 89. A patient is recovering from surgery and reports acute pain. Which of the following interventions should the nurse try first to manage the patient's pain? A. Administer the prescribed opioid analgesic. B. Ask the patient to use relaxation techniques. C. Apply a cold compress to the affected area. D. Position the patient for comfort and provide distractions. Answer. D. Position the patient for comfort and provide distractions. Rationale. Comfort measures like positioning and distractions should be tried first before medication is administered. Non-pharmacological methods can help manage pain and reduce the need for medication. If pain persists, other interventions like medications, A, B, or cold therapy, C, can be considered. 90. A nurse is caring for a patient with acute pain from a recent injury. Which of the following statements by the patient would indicate the need for further education on pain management? A. I should only take the pain medication when the pain becomes unbearable. B. I will try to use relaxation techniques if the pain is mild. C. I understand that pain medication should be taken on a regular schedule. D. I can apply heat to my injury to help reduce the pain. Answer. A. I should only take the pain medication when the pain becomes unbearable. Rationale. Pain medication should be taken regularly as prescribed to maintain effective pain control, not just when pain is unbearable. A. The other statements, B, C, D, demonstrate an understanding of pain management strategies. 91. A nurse is caring for a patient who has undergone surgery and reports pain. The nurse should recognize that which of the following is the most effective method for assessing the patient's pain? A. Observing the patient for signs of discomfort. B. Asking the patient to rate pain using a numeric pain scale. C. Monitoring the patient's vital signs. D. Checking for nonverbal cues like facial grimacing. Answer. B. Asking the patient to rate pain using a numeric pain scale. Rationale. The most effective way to assess pain is by asking the patient to rate it on a scale, as pain is subjective. Observing nonverbal cues, A. Monitoring vital signs, C. And checking grimacing, D. Can provide supplementary information, but do not directly assess pain. 92. A nurse is caring for a patient who is prescribed an opioid analgesic for acute pain. The patient reports feeling nauseated. Which intervention should the nurse implement first? A. Offer the patient a glass of water. B. Administer an antiemetic as prescribed. C. Hold the next dose of opioid analgesic. D. Encourage the patient to lie down in a quiet room. Answer. B. Administer an antiemetic as prescribed. Rationale. Nausea is a common side effect of opioids, and the most effective way to manage it is by administering an antiemetic. Offering water, A. Withholding the next dose, C. And encouraging rest, D. May not resolve the nausea as effectively. 93. A patient who underwent abdominal surgery is complaining of pain despite receiving opioids. The nurse should consider which of the following as the most likely cause of the persistent pain? A. Tolerance to the opioid medication. B. Inadequate dose of opioid analgesic. C. Development of an infection at the surgical site. D. The patient's noncompliance with the prescribed regimen. Answer: B. Inadequate dose of opioid analgesic. Rationale: if the patient is not experiencing adequate pain relief despite receiving opioids, the most likely cause is an insufficient dose of the medication. Tolerance, A, and noncompliance, D, may also play a role, but inadequate dosing, B, is the most common cause. Infection, C, should be considered if other symptoms are present. 94. A nurse is caring for a postoperative patient who is using a PCA pump. The nurse notices the patient is pressing the button more frequently than usual. What is the most appropriate response by the nurse? A. Reassure the patient that the PCA pump has built-in safety features to prevent overdosing. B. Assess the patient's pain level to ensure adequate pain control. C. Administer a larger dose of the prescribed analgesic. D. Decrease the patient's PCA button usage to every hour. Answer: B. Assess the patient's pain level to ensure adequate pain control. Rationale: the nurse should assess the patient's pain level to determine if more frequent PCA button usage is warranted. The built-in safety features, A, are helpful, but an assessment, B, is needed first. Increasing the dose, C, and restricting PCA use, D, without a clear rationale are inappropriate. 95. A nurse is caring for a patient with severe pain following a traumatic injury. The healthcare provider prescribes a non-steroidal anti-inflammatory drug, NSAID. Which of the following is the most important assessment for the nurse to perform before administering the NSAID? A. Assess the patient's temperature. B. Assess for a history of gastrointestinal ulcers. C. Assess the patient's liver function. D. Assess for a history of asthma. Answer: B. Assess for a history of gastrointestinal ulcers. Rationale: NSAIDs can cause gastrointestinal bleeding, so it is important to assess for a history of ulcers. B. Temperature, A, liver function, C, and asthma, D, are important but less relevant to NSAID administration. 96. A patient is being discharged after surgery and is prescribed opioid analgesics for pain. The nurse provides discharge teaching. Which statement by the patient indicates the need for further teaching? A. I should take the medication as soon as I feel any pain. B. I will take the medication exactly as prescribed to avoid the risk of addiction. C. I will keep the medication in a locked cabinet out of reach of children. D. I should stop taking the medication when I feel my pain is gone. Answer: D. I should stop taking the medication when I feel my pain is gone. Rationale: it is important to continue taking the prescribed pain medication as directed to avoid withdrawal symptoms and ensure proper pain management. The other statements, A, B, C, demonstrate proper understanding of opioid safety. 97. A nurse is caring for a patient who is receiving opioid analgesics for severe pain. The nurse observes that the patient is experiencing difficulty urinating. What is the most likely cause of this issue? A. The patient is dehydrated. B. The opioid analgesic is causing urinary retention. C. The patient has an infection in the urinary tract. D. The patient is experiencing anxiety about the pain. Answer: B. The opioid analgesic is causing urinary retention. Rationale: opioids can cause urinary retention as a side effect. Dehydration, A, urinary tract infections, C, and anxiety, D, can cause urinary issues, but are less likely in this scenario. 98. A nurse is teaching a patient who will be using a PCA, patient-controlled analgesia, pump for postoperative pain relief. Which statement by the patient indicates a need for further education? A. I will only press the button when the pain becomes unbearable. B. I can control my pain by pressing the button whenever I need it. C. I will let the nurse know if I feel too sleepy or have trouble breathing. D. The PCA pump allows me to control how much pain medication I receive. Answer: A. I will only press the button when the pain becomes unbearable. Rationale: the patient should be encouraged to use the PCA pump to maintain a consistent level of pain relief rather than waiting for the pain to become unbearable. The other statements, B, C, D, indicate an appropriate understanding of PCA use. 99. A nurse is assessing a postoperative patient who reports severe pain despite receiving opioid analgesics. The nurse should first A. Administer additional opioid medication. B. Notify the healthcare provider for further orders. C. Assess the patient's pain level and look for nonverbal signs of pain. D. Increase the patient's fluid intake. Answer. C. Assess the patient's pain level and look for nonverbal signs of pain. Rationale. Before taking any further action, the nurse should assess the patient's pain level and nonverbal signs of discomfort. This will help determine if additional interventions, A, B, or other strategies are needed. Increasing fluid intake, D, is unlikely to help with pain management. 100. A patient receiving opioid analgesics for severe pain asks the nurse about the potential for addiction. The nurse's most appropriate response is A. Addiction is unlikely if you use the medication as prescribed. B. You should avoid taking opioid medications unless absolutely necessary. C. Once you are no longer in pain, you can stop taking the medication. D. You should take the medication only when you feel the pain is severe. Answer. A. Addiction is unlikely if you use the medication as prescribed. Rationale. When used as prescribed for acute pain, the risk of addiction is low. The nurse should provide reassurance and focus on proper medication management. Avoiding medications entirely, B. Stopping them prematurely, C. Or using them only when pain is severe, D. May not provide effective pain relief. 101. A patient recovering from abdominal surgery reports pain at a level of 8 on a scale of 0 to 10. The nurse administers the prescribed opioid analgesic. What should the nurse do next? A. Wait for 30 minutes and reassess the patient's pain level. B. Encourage the patient to rest and avoid movement. C. Reassess the patient's pain after 1 hour. D. Assess for any potential side effects of the opioid. Answer. A. Wait for 30 minutes and reassess the patient's pain level. Rationale. The nurse should reassess the pain level 30 minutes after administering opioid medication, as this is typically when the peak effect occurs. Waiting longer, C, or encouraging rest, B, may delay pain relief assessment. Assessing side effects, D, is also important, but the priority is to reassess pain. 102. A nurse is caring for a patient who is receiving epidural analgesia for postoperative pain control. Which complication should the nurse monitor for closely in this patient? A. Respiratory depression. B. Hypertension. C. Abdominal distension. D. Nausea and vomiting. Answer. A. Respiratory depression. Rationale. Respiratory depression is a major concern with opioid use, including epidural analgesia, and must be closely monitored. Hypertension, B. Abdominal distension, C. And nausea, D. are less likely to occur with epidural opioids compared to systemic administration. 103. A nurse is caring for a patient experiencing severe pain from a burn injury. The nurse should first A. Administer an opioid analgesic. B. Use a cold compress to decrease pain. C. Assess the pain using a pain scale. D. Prepare the patient for surgery. Answer. C. Assess the pain using a pain scale. Rationale. The nurse should first assess the patient's pain to determine the severity and guide the appropriate intervention. Administering analgesics, A, or using cold compresses, B, may be appropriate later, but proper assessment, C, is the first step. Surgery, D, is not an immediate concern in this scenario. 104. A nurse is caring for a patient with acute pain after a knee injury. The patient is hesitant to take opioid medications due to concerns about addiction. Which response is best? A. Opioids are safe when used as prescribed and are effective for pain relief. B. You should avoid opioid medications and try alternative treatments. C. Opioids should only be used for the shortest time possible. D. Opioids will be necessary for long-term pain management. Answer. A. Opioids are safe when used as prescribed and are effective for pain relief. Rationale. The nurse should reassure the patient that opioids are safe when used appropriately for acute pain and that the risk of addiction is low when used as prescribed. Alternatives, B, and long-term use, D, may not be appropriate for acute pain and short-term use, C, should be emphasized in context. 105. A nurse is caring for a postoperative patient who reports nausea and dizziness after receiving opioid medication for pain relief. The nurse should A. Hold the next dose of opioid and notify the healthcare provider. B. Offer the patient a glass of water to prevent dehydration. C. Administer an antiemetic as prescribed. D. Encourage the patient to sit up and drink fluids. Answer: C. Administer an antiemetic as prescribed. Rationale: nausea and dizziness are common side effects of opioid analgesics, and the most effective response is to administer an antiemetic. C. Holding the next dose, A, may not be necessary, and offering water, B, or encouraging sitting, D, may not address the cause of the symptoms. 106. A nurse is teaching a patient with acute pain about non-pharmacological pain management strategies. Which technique should the nurse include as an effective intervention? A. Transcutaneous electrical nerve stimulation, TENS. B. Increasing the room temperature to a high setting. C. Focusing solely on the pain experience. D. Using ice packs for prolonged periods. Answer: A. Transcutaneous electrical nerve stimulation, TENS. Rationale: TENS is an effective non-pharmacological pain management technique that helps reduce pain. High temperatures, B, may worsen pain. Focusing on pain, C, can increase discomfort, and prolonged ice use, D, can cause tissue damage. 107. A patient who underwent surgery for a fractured arm is prescribed acetaminophen for pain. The nurse should monitor the patient for which potential side effect? A. Respiratory depression. B. Liver toxicity. C. Nausea and vomiting. D. Urinary retention. Answer: B. Liver toxicity. Rationale: acetaminophen is metabolized in the liver, and excessive use can lead to liver toxicity. Respiratory depression, A, nausea, C, and urinary retention, D, are more common with opioids than with acetaminophen. 108. A nurse is caring for a patient with acute pain after a spinal cord injury. The nurse should assess the patient for which of the following signs of pain? A. Increased blood pressure and heart rate. B. Decreased respiratory rate and shallow breathing. C. Increased urinary output and sweating. D. Decreased temperature and cold extremities. Answer: A. Increased blood pressure and heart rate. Rationale: pain often causes physiological responses such as increased blood pressure and heart rate. A. The other signs, B, C, D, are less likely to be associated with pain and may suggest other issues. 109. A nurse is caring for a patient who is receiving opioid analgesics for postoperative pain. The patient becomes drowsy and difficult to arouse. What should the nurse do first? A. Stimulate the patient to wake them up. B. Assess the patient's respiratory rate and oxygen saturation. C. Notify the healthcare provider immediately. D. Administer naloxone to reverse the opioid effects. Answer: B. Assess the patient's respiratory rate and oxygen saturation. Rationale: the first step is to assess for respiratory depression, a potential complication of opioid use. Stimulating the patient, A, notifying the provider, C, and administering naloxone, D, may be necessary depending on the severity, but assessment, B, comes first. 110. A nurse is caring for a patient who is using a TENS unit for pain relief. The nurse should teach the patient that the TENS unit, A, will completely eliminate pain. B, can be used for short-term pain relief only. C, works by stimulating nerves to block pain signals. D, is most effective when used in combination with opioid analgesics. Answer: C, works by stimulating nerves to block pain signals. Rationale: TENS works by delivering electrical impulses to nerves, which helps block pain signals. It does not completely eliminate pain, A, or require opioids, D, and, while it can provide effective short-term relief, B, it does not replace other treatments. 111. A nurse is caring for a patient receiving an opioid for acute pain. The patient reports experiencing constipation. Which of the following interventions should the nurse recommend? A, increase fluid intake and encourage mobility. B, administer an antidiarrheal medication. C, discontinue the opioid medication immediately. D, suggest a low-fiber diet. Answer: A. Increase fluid intake and encourage mobility. Rationale. Constipation is a common side effect of opioids. Increasing fluid intake and encouraging mobility, A, can help alleviate constipation. Antidiarrheals, B, are not appropriate for opioid-induced constipation. Discontinuing the opioid, C, may not be necessary, and a low-fiber diet, D, may worsen constipation. 112. A patient with acute pain following surgery is refusing to take medication. What is the most appropriate action for the nurse to take? A. Encourage the patient to take the medication to prevent more pain. B. Respect the patient's decision and avoid further discussion. C. Discuss the benefits and risks of pain management options with the patient. D. Tell the patient that pain relief is necessary for proper healing. Answer. C. Discuss the benefits and risks of pain management options with the patient. Rationale. It is important to provide education to the patient about the benefits and risks of pain management. C. To make an informed decision. Encouraging medication without discussion. A. Avoiding the issue. B. Or pressuring the patient. D. Are not ideal approaches. 113. A nurse is caring for a patient experiencing acute pain after an injury. The nurse explains that acute pain can result from which of the following? A. Long-term tissue damage. B. Nerve injury. C. Recent surgery or injury. D. Chronic conditions. Answer. C. Recent surgery or injury. Rationale. Acute pain typically results from recent tissue injury or surgery. C. It differs from chronic pain, which can result from long-term conditions or persistent nerve damage. A.D. 114. A patient is receiving opioid analgesics for postoperative pain and reports difficulty breathing. What is the nurse's first action? A. Increase the dose of opioid analgesic. B. Encourage the patient to cough and deep breathe. C. Administer oxygen therapy. D. Notify the healthcare provider immediately. Answer. B. Encourage the patient to cough and deep breathe. Rationale. Difficulty breathing may be related to shallow breathing due to pain. Encouraging the patient to cough and deep breathe, B, can help. Administering oxygen, C, may be necessary later, but assessing the patient first is the priority. Increasing the opioid dose, A, is inappropriate, and notification, D, is also important, but not the first step. 115. Which of the following is a non-pharmacological intervention that a nurse can use to help manage a patient's acute pain? A. Giving opioid pain medications. B. Encouraging guided imagery. C. Offering a heating pad on a high setting. D. Increasing the dose of pain medications. Answer. B. Encouraging guided imagery. Rationale. Guided imagery is a non-pharmacological intervention that can help manage acute pain by promoting relaxation and distraction. B. Opioid medications, A, and increasing doses, D, are pharmacological interventions. A heating pad on a high setting, C, can cause burns and should not be used at high temperatures. 116. A patient receiving epidural analgesia for pain control reports increasing pain despite the analgesic. What is the nurse's first priority? A. Administer a stronger dose of medication. B. Check the patient's pain level again in 30 minutes. C. Assess the placement and function of the epidural catheter. D. Notify the healthcare provider for additional orders. Answer. C. Assess the placement and function of the epidural catheter. Rationale. The nurse should first assess the placement and function of the epidural catheter, C, to ensure the analgesia is being delivered properly. Administering more medication, A, or waiting, B, may delay necessary interventions. Notifying the healthcare provider, D, may be necessary, but assessment is the first priority. 117. When assessing a patient's acute pain level, which of the following pain scales is the most appropriate for a nonverbal patient? A. Numeric rating scale. B. Visual analog scale. C. Wong-Baker Faces scale. D. Behavioral pain scale. Answer. D. Behavioral pain scale. Rationale. The behavioral pain scale, D, is designed for nonverbal patients and uses observable behaviors to assess pain. The other scales, A, B, C, require patient communication and are not appropriate for nonverbal patients. 118. A nurse is preparing to administer pain medication to a postoperative patient. The nurse knows that the patient is at risk for developing opioid-induced hyperalgesia. Which of the following should the nurse include in the patient's care plan? A. Administer high doses of opioids regularly. B. Monitor for signs of increased pain sensitivity. C. Reduce non-opioid pain management. D. Avoid offering alternative pain management techniques. Answer. B. Monitor for signs of increased pain sensitivity. Rationale. Opioid-induced hyperalgesia involves increased sensitivity to pain, and the nurse should monitor for this. B. High doses of opioids, A, should be avoided, and non-opioid methods, C, D, should still be considered as part of a comprehensive pain management plan. 119. A nurse is teaching a patient with acute pain about the use of a pain scale. Which of the following statements should the nurse include in the teaching? A. The pain scale is used to measure your emotional response to pain. B. You should rate your pain as low as possible at all times. C. The pain scale helps the healthcare team understand the severity of your pain. D. Only rate your pain when it is at its worst. Answer. C. The pain scale helps the healthcare team understand the severity of your pain. Rationale. The pain scale is used to assess the severity of pain to guide treatment. C. It is not used to measure emotions, A, or require the lowest rating, B. Rating pain at its worst only, D, may not provide an accurate representation of the patient's overall pain experience. 120. A nurse is caring for a patient who has acute pain and is at risk for developing chronic pain. What should the nurse focus on to reduce this risk? A. Administering high doses of opioid analgesics for long-term relief. B. Offering relaxation and distraction techniques to promote comfort. C. Focusing only on pharmacological pain management. D. Ignoring the patient's report of pain to prevent medication dependence. Answer. B. Offering relaxation and distraction techniques to promote comfort. Rationale. Non-pharmacological techniques, B, such as relaxation and distraction, can help manage acute pain and reduce the risk of developing chronic pain. Long-term use of opioids, A, is not recommended, and focusing only on medications, C, or ignoring pain, D, can lead to worsened outcomes. 121. A nurse is caring for a patient who has acute pain after a lumbar puncture. Which of the following should the nurse assess first? A, the patient's mobility. B, the patient's pain level. C, the patient's emotional state. D, the patient's diet and fluid intake. Answer. B, the patient's pain level. Rationale. The nurse should first assess the patient's pain level, B, to determine the appropriate intervention. While mobility, A, emotional state, C, and diet, D, are important, pain level is the immediate priority after a procedure like lumbar puncture. 122. Which of the following interventions is appropriate for managing acute pain in a patient recovering from surgery? A. Encourage the patient to remain immobile to prevent further pain. B. Provide frequent reassessment of pain and medication needs. C. Limit fluid intake to reduce the risk of nausea. D. Withhold opioid analgesics until the pain is severe. Answer. B. Provide frequent reassessment of pain and medication needs. Rationale. Frequent reassessment of pain and medication needs, B, ensures that the patient's pain is effectively managed. Encouraging immobility, A, may increase pain, limiting fluid intake, C, can lead to dehydration, and withholding opioids until pain is severe, D, is not an effective strategy. 123. A nurse is caring for a patient who is receiving a PCA, patient-controlled analgesia, pump for pain management. What is the nurse's priority action? A. Instruct the patient to push the button for medication whenever they feel pain. B. Monitor the patient's respiratory rate and level of sedation. C. Encourage the patient to push the button frequently to prevent pain. D. Disconnect the PCA pump once the pain is controlled. Answer. B. Monitor the patient's respiratory rate and level of sedation. Rationale. The nurse should monitor for respiratory depression and sedation when the patient is using a PCA pump. Instructing the patient to push the button, A, or encouraging frequent use, C, may lead to overuse, and disconnecting the PCA, D, prematurely can result in uncontrolled pain. 124. A patient who is receiving opioid analgesics for acute pain management expresses concern about becoming addicted. What is the best response by the nurse? A. You should not worry about addiction since you will only need the medication for a short time. B. Opioids are the most effective way to manage your pain, and addiction is rare. C. You can stop taking the medication whenever you feel the pain is under control. D. Let me explain how we will monitor your pain and use medications safely to reduce risks. Answer. D. Let me explain how we will monitor your pain and use medications safely to reduce risks. Rationale. The nurse should provide education on safe medication use and reassure the patient that the healthcare team will monitor their pain to reduce risks. The other responses, A, B, C, may not fully address the patient's concerns. 125. A nurse is assessing a postoperative patient who has received opioid analgesics. The patient is drowsy but easily aroused. Which of the following is the most appropriate action by the nurse? A. Increase the opioid dosage. B. Encourage the patient to walk around. C. Monitor the patient's respiratory rate and sedation level. D. Notify the healthcare provider immediately. Answer. C. Monitor the patient's respiratory rate and sedation level. Rationale. The nurse should closely monitor the patient's respiratory rate and sedation level to ensure safety, as drowsiness can indicate sedation due to opioids. Increasing the dosage, A, or encouraging walking, B, is not appropriate. Notifying the healthcare provider, D, is important if sedation worsens, but monitoring is the first step. 126. A nurse is caring for a patient who is receiving epidural analgesia. The nurse notices that the patient's blood pressure is decreasing. What is the most appropriate action by the nurse? A. Increase the dose of the analgesic. B. Place the patient in a supine position. C. Increase fluid intake and administer 4 fluids. D. Notify the healthcare provider immediately. Answer. C. Increase fluid intake and administer 4 fluids. Rationale. Epidural analgesia can cause hypotension due to vasodilation. The nurse should increase fluid intake and administer 4 fluids, C, to address the hypotension. Increasing the analgesic dose, A, is not appropriate, and placing the patient supine, B, may not effectively treat the underlying issue. Notifying the healthcare provider, D, is important, but should follow the immediate intervention. 127. A patient who underwent abdominal surgery is experiencing moderate pain. The nurse plans to administer an opioid analgesic, but the patient has a history of substance use disorder. Which of the following is the most appropriate action by the nurse? A. Avoid administering the opioid and use non-pharmacological methods only. B. Administer the opioid at the prescribed dose and monitor closely. C. Reduce the opioid dosage and rely on non-opioid analgesics. D. Encourage the patient to discuss their pain with their healthcare provider. Answer. B. Administer the opioid at the prescribed dose and monitor closely. Rationale. The nurse should administer the opioid as prescribed, B, but with increased monitoring due to the patient's history of substance use disorder. Non-pharmacological methods can be helpful, but they should not be the only intervention, A. Reducing the dose, C, may not provide adequate pain relief, and encouraging the patient to discuss their pain, D, is important but should not replace appropriate pain management. 128. A patient who is recovering from surgery reports feeling pain despite receiving an opioid analgesic. The nurse should first assess which of the following? A. The patient's vital signs. B. The effectiveness of the opioid. C. The patient's level of sedation. D. The patient's comfort level with the environment. Answer. B. The effectiveness of the opioid. Rationale. The nurse should first assess the effectiveness of the opioid, B, in managing the patient's pain. Vital signs, A, and sedation level, C, are also important but come after determining if the pain relief is sufficient. The patient's environment, D, may impact comfort but is less urgent than pain assessment. 129. A nurse is teaching a patient how to use a PCA, patient-controlled analgesia, pump. Which of the following instructions should the nurse include? A. You can push the button to receive a dose of pain medication when you feel pain. B. The PCA will automatically adjust the dose for you throughout the day. C. You can use the PCA pump only if your pain becomes severe. D. You will not be able to use the PCA if you are feeling drowsy. Answer: A. You can push the button to receive a dose of pain medication when you feel pain. Rationale: the PCA pump allows the patient to self-administer pain medication when they feel pain. A. It does not automatically adjust the dose. B. Should not be used only for severe pain. C. And should be used cautiously if the patient is drowsy, but not restricted completely. D. 130. A nurse is caring for a patient who is receiving opioid analgesics for pain relief. The patient exhibits symptoms of nausea and vomiting. What is the nurse's first priority? A. Administer an antiemetic as prescribed. B. Reduce the opioid dose. C. Encourage the patient to take deep breaths. D. Notify the healthcare provider. Answer: A. Administer an antiemetic as prescribed. Rationale: the nurse should first administer an antiemetic to address nausea and vomiting. A. A common side effect of opioids. Reducing the opioid dose. B. May not be necessary unless the symptoms persist, and deep breathing. C. May help, but is not a primary intervention. Notifying the healthcare provider. D. Is important if the symptoms worsen, but addressing nausea is the first step. 131. A patient is receiving opioid therapy for acute pain management. The nurse recognizes that the patient is at risk for developing opioid tolerance. Which of the following strategies can help minimize this risk? A. Administer high doses of opioids for rapid pain relief. B. Use a combination of opioids and non-opioid analgesics. C. Avoid using non-pharmacological pain management techniques. D. Increase opioid doses regularly to prevent tolerance. Answer: B. Use a combination of opioids and non-opioid analgesics. Rationale: a combination of opioids and non-opioid analgesics. B. Helps to manage pain more effectively while reducing the need for higher doses of opioids, thereby minimizing the risk of tolerance. Using high doses of opioids, A, and regularly increasing doses, D, may increase tolerance. Non-pharmacological methods, C, should still be incorporated. 132. A nurse is assessing a postoperative patient who reports pain at a level of 7 out of 10 on a pain scale. The nurse is preparing to administer an opioid analgesic. Which of the following is the most important to assess before administering the medication? A. The patient's respiratory rate. B. The patient's previous pain experiences. C. The patient's blood pressure. D. The patient's appetite. Answer: A. The patient's respiratory rate. Rationale: opioid analgesics can cause respiratory depression, so it is crucial to assess the patient's respiratory rate, A, before administering the medication. While blood pressure, C, and appetite, D, are important, the respiratory rate is the primary concern. Previous pain experiences, B, may provide context but are not as immediately critical. 133. A nurse is caring for a patient who is receiving opioid analgesics and is at risk for constipation. Which of the following interventions is most appropriate? A. Increase the patient's fiber intake. B. Discontinue opioid analgesics immediately. C. Provide a stool softener or laxative. D. Limit the patient's fluid intake. Answer: C. Provide a stool softener or laxative. Rationale: opioid analgesics can cause constipation, so providing a stool softener or laxative, C, is the appropriate intervention. Increasing fiber, A, is helpful but not as immediate. Discontinuing opioids, B, may not be necessary, and limiting fluid intake, D, would worsen constipation. 134. A nurse is educating a patient who is receiving opioid analgesics for pain management. Which of the following should the nurse include in the teaching? A. You should stop taking the medication once your pain decreases. B. You can safely drive while on opioid medications as long as you are not in pain. C. Opioid medications can cause drowsiness, so avoid activities that require full alertness. D. Opioid medications are not addictive if used for short periods. Answer: C. Opioid medications can cause drowsiness, so avoid activities that require full alertness. Rationale: opioid medications can cause drowsiness, C, and the patient should be advised to avoid activities requiring full alertness. Stopping medication too early, A, can cause inadequate pain relief, driving is unsafe due to drowsiness, B, and opioids can be addictive even with short-term use, D. 135. A patient is receiving PCA, patient-controlled analgesia, for postoperative pain. The nurse notices that the patient is pushing the button more frequently than prescribed. What is the nurse's first action? A. Decrease the dose of medication. B. Assess the patient's pain level and sedation level. C. Increase the PCA settings. D. Notify the healthcare provider immediately. Answer: B. Assess the patient's pain level and sedation level. Rationale: the nurse should first assess the patient's pain level and sedation to determine if the patient requires more pain relief or is at risk for opioid overdose. B. Decreasing the dose, A, or increasing the settings, C, without assessment could be harmful. Notifying the healthcare provider, D, may be necessary but should come after assessment. 136. A nurse is caring for a patient who is receiving opioid analgesics for acute pain relief. The patient asks about the side effects of opioids. Which of the following is the most common side effect? A. Hypotension. B. Respiratory depression. C. Constipation. D. Tachycardia. Answer: C. Constipation. Rationale: constipation, C, is a common side effect of opioids, while respiratory depression, B, and hypotension, A, are serious risks. Constipation is the most common and often less immediately life-threatening. Tachycardia, D, is not a typical side effect. 137. A nurse is preparing to administer opioid analgesics to a postoperative patient. The patient is experiencing severe pain and is requesting more medication. The nurse should assess which of the following first? A. The patient's pain level. B. The patient's vital signs. C. The patient's level of sedation. D. The patient's previous pain experiences. Answer: B. The patient's vital signs. Rationale: before administering more medication, the nurse should assess vital signs, B, especially respiratory rate and blood pressure, to ensure the patient is not at risk for opioid overdose. Pain level, A, and sedation level, C, are also important but follow vital signs. Previous pain experiences, D, are helpful but not immediate. 138. A nurse is caring for a patient who is receiving opioid analgesics for postoperative pain. The patient reports feeling dizzy and lightheaded after receiving medication. What is the nurse's first action? A. Encourage the patient to drink water. B. Place the patient in a low Fowler's position. C. Withhold further doses of medication. D. Notify the healthcare provider immediately. Answer: B. Place the patient in a low Fowler's position. Rationale: dizziness and lightheadedness can be caused by opioid-induced hypotension, so placing the patient in a low Fowler's position, B, can help alleviate these symptoms. Encouraging fluid, A, is helpful, but not the first priority. Withholding medication, C, may be necessary if symptoms persist, and notifying the healthcare provider, D, should follow assessment. 139. A nurse is caring for a patient who is receiving opioid analgesics and is at risk for developing respiratory depression. The nurse should monitor for which of the following signs? A. Bradycardia. B. Shallow, slow breathing. C. Elevated blood pressure. D. Hyperactive reflexes. Answer: B. Shallow, slow breathing. Rationale: opioid analgesics can cause respiratory depression, which is characterized by shallow and slow breathing. B. Bradycardia, A, may occur, but it is not as characteristic. Elevated blood pressure, C, and hyperactive reflexes, D, are not common signs of opioid-induced respiratory depression. 140. A nurse is caring for a patient who is receiving opioid analgesics. The patient is requesting pain medication every hour, but the prescribed interval is every 4 hours. The nurse should first assess which of the following? A. The patient's pain level. B. The patient's vital signs. C. The patient's respiratory rate. D. The patient's history of substance abuse. Answer: A. The patient's pain level. Rationale: the first step is to assess the patient's pain level, A, to determine whether the pain is being effectively managed. Vital signs, B, respiratory rate, C, and substance abuse history, D, are important but secondary to assessing the pain. 141. A nurse is assessing a patient after surgery. The patient is complaining of severe pain and has a decreased level of consciousness. What should the nurse do first? A. Administer pain medication. B. Assess the patient's vital signs. C. Notify the healthcare provider immediately. D. Increase the patient's spore fluids. Answer. B. Assess the patient's vital signs. Rationale. Before administering pain medication or notifying the healthcare provider, the nurse must first assess the patient's vital signs. B. To understand the severity of the patient's condition. Administering medication, A, or increasing fluids, D, may not be appropriate without knowing the patient's status. 142. A nurse is providing education to a patient on the proper use of an inhaler. Which of the following statements by the patient indicates a need for further education? A. I will shake the inhaler before using it. B. I will hold my breath for 10 seconds after inhaling the medication. C. I will exhale fully before using the inhaler. D. I will use the inhaler every 6 hours, even if I am not having symptoms. Answer. D. I will use the inhaler every 6 hours, even if I am not having symptoms. Rationale. Inhalers are typically used for symptom relief, and patients should not use them routinely, D, without symptoms. The other statements, A, B, and C, reflect proper technique for inhaler use. 143. A nurse is caring for a patient with an indwelling urinary catheter. The nurse should prioritize which action to prevent a urinary tract infection? A. Empty the drainage bag every 12 hours. B. Clean the perineal area with soap and water daily. C. Keep the catheter drainage bag above the level of the bladder. D. Use a sterile technique when inserting the catheter. Answer. C. Keep the catheter drainage bag above the level of the bladder. Rationale. To prevent a urinary tract infection, it is important to keep the catheter drainage bag below the bladder level. C. To prevent backflow of urine. Emptying the bag, A, is necessary but not sufficient, and using sterile technique, D, is critical only at the time of insertion. 144. A nurse is caring for a postoperative patient who is receiving opioid pain medication. The patient is at risk for constipation. Which of the following interventions should the nurse prioritize? A. Increase the patient's fluid intake. B. Administer a stool softener as prescribed. C. Encourage the patient to eat more fiber. D. Perform abdominal massage. Answer. B. Administer a stool softener as prescribed. Rationale. Opioid medications commonly cause constipation, and stool softeners, B, help to prevent this side effect. Increasing fluid intake, A, and fiber, C, are helpful but may not be effective on their own, and abdominal massage, D, may be helpful but is not the priority. 145. A nurse is teaching a patient about the potential side effects of opioid analgesics. Which of the following should the nurse include in the education? A. Opioids can cause drowsiness and constipation. B. Opioids can reduce the risk of urinary tract infections. C. Opioids increase appetite and cause weight gain. D. Opioids improve cognitive function. Answer. A. Opioids can cause drowsiness and constipation. Rationale. Drowsiness and constipation, A, are common side effects of opioids. The other options, B, C, D, are incorrect and do not reflect typical side effects of opioids. 146. A nurse is caring for a patient who is receiving opioid analgesics for postoperative pain. The nurse is concerned about the risk of respiratory depression. Which of the following is the most important assessment? A. Blood pressure. B. Heart rate. C. Respiratory rate. D. Temperature. Answer. C. Respiratory rate. Rationale. Opioids can cause respiratory depression, so monitoring the respiratory rate, C, is the most important. Blood pressure, A, heart rate, B, and temperature, D, are also important, but they are not as closely related to opioid-induced respiratory depression. 147. A nurse is caring for a patient who is receiving epidural analgesia for pain management after surgery. The nurse should monitor for which of the following complications? A. Hemorrhage. B. Infection at the catheter insertion site. C. Hyperkalemia. D. Hypertension. Answer. B. Infection at the catheter insertion site. Rationale. Epidural analgesia poses a risk for infection at the insertion site, B, and close monitoring is necessary. Hemorrhage, A, and hyperkalemia, C, are not common complications, and hypertension, D, is not typically associated with epidural analgesia. 148. A nurse is caring for a patient with acute pain from a fractured leg. The nurse should use which of the following pain assessment tools? A. Numeric pain scale. B. Wong-Baker Faces scale. C. Visual analog scale. D. All of the above. Answer. D. All of the above. Rationale. All of the listed pain assessment tools, A, B, and C, are valid for assessing acute pain, and the choice depends on the patient's age and cognitive ability. All of these can provide useful data about pain intensity. 149. A nurse is caring for a patient who is receiving pain management through patient-controlled analgesia, PCA. Which of the following is the nurse's priority? A. Ensure the patient understands how to use the PCA device. B. Monitor the patient's vital signs frequently. C. Provide additional pain medication if the patient reports severe pain. D. Assess the patient's comfort level every hour. Answer. A. Ensure the patient understands how to use the PCA device. Rationale. Patient education, A, is the priority to ensure safe use of the PCA device. Vital signs, B, and comfort, D, are also important but secondary to teaching the patient how to use the device. Providing additional medication, C, should not be done without assessment. 150. A nurse is assessing a patient's pain level after administering an analgesic. The patient reports a pain level of 4 out of 10 but is grimacing and holding their abdomen. What should the nurse do? A. Assume the patient is experiencing mild pain and document the findings. B. Administer additional analgesic medication. C. Reassess the patient's pain after 30 minutes. D. Notify the healthcare provider immediately. Answer. C. Reassess the patient's pain after 30 minutes. Rationale. The nurse should reassess the pain level, C, to determine if the current pain management is effective. Administering additional medication, B, is premature without reassessment, and notification of the healthcare provider, D, is not the first action. 151. A nurse is caring for a patient who is receiving pain management via a fentanyl patch. Which of the following is the nurse's priority action? A. Change the patch every 72 hours. B. Check the patient's temperature regularly. C. Apply the patch to the patient's back. D. Remove the patch before administering another pain medication. Answer. A. Change the patch every 72 hours. Rationale. Fentanyl patches are typically changed every 72 hours. A. Monitoring temperature, B, is not a priority, and the patch should not be applied to the back. C. Removing the patch before administering other pain medications, D, is unnecessary unless instructed. 152. A nurse is assessing a patient with acute pain related to a burn injury. Which of the following is the most important priority for the nurse? A. Administer analgesics as prescribed. B. Monitor the patient's vital signs. C. Evaluate the patient's response to pain management. D. Ensure that the burn area is clean and free from infection. Answer. A. Administer analgesics as prescribed. Rationale. Administering analgesics, A, promptly is the priority in managing acute pain. Monitoring vital signs, B, and evaluating response to pain management, C, are important but secondary to effective pain relief. Ensuring the burn is clean, D, is important, but pain relief comes first. 153. A nurse is providing care for a postoperative patient who is at risk for developing acute pain. Which of the following is a key preventative measure? A. Administering opioids immediately post-surgery. B. Using a multimodal approach to pain management. C. Encouraging the patient to ambulate frequently. D. Reducing the patient's fluid intake. Answer. B. Using a multimodal approach to pain management. Rationale. A multimodal approach, B, that combines different types of pain management techniques is most effective in preventing acute pain. Administering opioids immediately, A, may not be appropriate without considering other interventions. Encouraging ambulation, C, is beneficial but not the primary prevention. 154. A nurse is caring for a patient with acute pain after abdominal surgery. The patient expresses a fear of addiction to pain medications. What is the nurse's best response? A. Pain medications, when used as prescribed, are not addictive. B. Opioids are only used for short-term pain relief, so addiction is not a concern. C. I understand your concern, but we will closely monitor your medication use. D. It's best to avoid pain medications and just try to tolerate the pain. Answer. C. I understand your concern, but we will closely monitor your medication use. Rationale. Acknowledging the patient's concern, C, and reassuring them about close monitoring is the most supportive response. Saying pain medications are not addictive, A, or opioids are only short-term, B, can be dismissive or misleading. Avoiding pain medication, D, is not appropriate for post-surgical pain management. 155. A nurse is teaching a patient about the use of heat therapy for pain management. Which of the following is the most important instruction? A. Apply heat for no longer than 20 minutes at a time. B. Use a heating pad on the highest setting for maximum effectiveness. C. Apply heat directly to broken skin or open wounds. D. Keep the heat application on continuously for the first 24 hours after injury. Answer. A. Apply heat for no longer than 20 minutes at a time. Rationale. Heat therapy should be applied for no longer than 20 minutes. A. To prevent skin damage. The heating pad should not be on the highest setting, B, and heat should not be applied to broken skin, C. Continuous heat, D, is not appropriate as it may cause skin damage. 156. A nurse is caring for a patient who has been prescribed an opioid analgesic for acute pain. Which of the following is a common side effect of opioids that the nurse should monitor for? A. Hypotension. B. Hyperventilation. C. Respiratory depression. D. Insomnia. Answer. C. Respiratory depression. Rationale. Respiratory depression, C, is a common and dangerous side effect of opioids. Hypotension, A, and hyperventilation, B, are not typical side effects, and insomnia, D, is not directly related to opioid use. 157. A nurse is caring for a patient with acute pain due to an injury. The nurse is planning non-pharmacological interventions. Which intervention should the nurse prioritize? A. Provide the patient with a back rub. B. Encourage the patient to use relaxation techniques. C. Teach the patient deep breathing exercises. D. Apply a cold compress to the painful area. Answer. B. Encourage the patient to use relaxation techniques. Rationale. Relaxation techniques, B, are effective in managing acute pain, while back rubs, A, deep breathing exercises, C, and cold compresses, D, are useful. The nurse should prioritize encouraging the patient to use techniques that they can control for pain relief. 158. A nurse is caring for a patient with acute pain after a traumatic injury. Which of the following should be included in the pain assessment? A. Asking the patient to rate their pain using a visual analog scale. B. Only observing the patient's facial expressions. C. Assuming that the pain level is related to the severity of the injury. D. Relying solely on the patient's medical history for pain assessment. Answer. A. Asking the patient to rate their pain using a visual analog scale. Rationale. The best method for assessing acute pain, A, is through patient self-report using a scale. Relying only on facial expressions, B, or injury severity, C, can be misleading. Medical history, D, alone does not provide an accurate assessment of current pain. 159. A nurse is caring for a patient who is recovering from surgery and is receiving PCA, patient-controlled analgesia. The patient asks how often they can push the PCA button. What is the nurse's best response? A. You can push the button whenever you feel pain. B. You can push the button every 10 minutes, but no more than once every 4 hours. C. You can push the button as often as you like, but you will only receive medication every hour. D. You can press the button up to the maximum dose prescribed in 1 hour. Answer. D. You can press the button up to the maximum dose prescribed in 1 hour. Rationale. PCA devices are typically programmed to administer a set dose of medication, and the patient can press the button up to the prescribed maximum dose within an hour. D. Options A, B, and C may not accurately reflect the prescribed dosing parameters. 160. A nurse is caring for a patient with acute pain after a traumatic injury. The nurse is preparing to administer an opioid. What is the priority nursing assessment before administering the opioid? A. Assess the patient's level of consciousness. B. Assess the patient's pain intensity. C. Assess the patient's blood pressure. D. Assess the patient's respiratory rate. Answer. D. Assess the patient's respiratory rate. Rationale. Opioids can cause respiratory depression, so assessing the respiratory rate, D, is the priority. While pain intensity, B, level of consciousness, A, and blood pressure, C, are important, respiratory rate is the most critical before administering opioids.